think it's always a really difficult thing when you are thinking that you need a new preceptor and trying to make that decision of, do you keep going or do you ask for a new preceptor? And part of it is, how much are you willing to do on your end, and are you still learning? If you're still learning, keep going. If you're not, you can talk to the educator about some opportunities. And there are times when your preceptor isn't going to be your best friend. Your personalities might not match well. But if it's not inhibiting your ability to learn and you can just work with that, I think that there's always something that you can learn from someone who's different than yourself. If you come into it with the idea or the notion of, I want a new preceptor, this isn't going to work, this isn't going to work, and you start every day out that way, it won't work. But you might not necessarily get a new preceptor. If a preceptor refuses to answer your question, and that's kind of the end of it, go find it on your own, and gives you none of the tools or the directions to find the answer, that's a huge problem. And at that point, I would say you can ask for a new preceptor. I think if your preceptor is always sitting at the desk and not participating with you, then that's a red flag that maybe you need a new preceptor. It's a really fine line. If this is near the beginning of your orientation, it's a bigger red flag to me. I feel very strongly that every preceptor should be there if it's a new procedure that nurse has never done before. Even if it's very simple, if you feel like you can't provide safe care to that patient and someone's refusing to help you, right there I would stop and I would not perform the procedure and ask for help and ask for a new preceptor. Looking at yourself to see if there's any way that you could improve the relationship, and making sure before you go to ask for a new preceptor that there's very tangible things that you're saying. This person is not helping me with new procedures, I'm really uncomfortable, rather than we can't get along, period, the end. You really have to have some examples of why you're not capable of learning under their leadership. I think if you've looked at some of these scenarios and you really feel for you it's time to get a new preceptor, or at least to start this discussion, I would start with your educator. If you're using some specific scenarios just to say, this is an example of when I didn't feel comfortable, this is what happened, I think that's great, because it's really going to help the educator understand what's happening or what's going wrong. It's a good point that it is for a short time. In the big scheme of things, you'll be on your own shortly. And the other thing, you can always ask other peers too. You don't have to go solely to your preceptor for every single question.